Special thanks to the PD Healthy Start. Marlboro County Council, as you know, is a non-profit corporation with over 40 active agencies, organizations, civic groups, and others who are interested in improving human services in Marlboro County. They attend the meetings, which makes our organization viable to our community. Now, our mission is to promote effective use and coordination of existing community resources, to provide a forum for mutual concerns, enlightenment, and benefit of members, to expand existing services and to develop sufficient resources to meet county-wide needs, and to provide a mechanism for input into human services, planning, development, and implementation. The Coordinating Council also functions to prevent duplications of services when possible, providing quality services with a minimum of time and money. It is not set up to be an agency or a grantor per se, although it at times is a conduit through which resources can flow to the community and to our members. 2 years ago, we received a planning grant to assess community needs and develop a long-term plan for the Coordinating Council. As we were finishing up our plan, the Council and all of its members had to pivot towards a crisis mode to deal with the COVID pandemic. I'm sure you had to do the same. Areas that we identified as concerns in the community became even more evident as we dealt with the crisis of food disparity, causing health and nutrition concerns, the need for parents to help their children to be ready for school, and mental health and family stress issues, as well as communications around resources that were available to cope with these issues. Over the past 2 years, we have supported vaccination and COVID testing efforts, helping find community sites where they can be offered, and getting the word out to places and time where they could go to receive their vaccination. Local agencies provided health information and screening for them, some of them in drive-through formats. We have served as a conduit for food resources, working with the neighborhood groups and agency staff to provide food distribution. We have provided activities and resources to parents to help them keep their children engaged in learning while at school, as well as supporting safe activities such as Sprout, the STEM Truck, Story Center, and resources for the local library children's program. In 2022, we will continue to focus on the areas we identified in our planning 2 years ago. We're working with a grant which includes a web page presence for the council. The web page will showcase community resources, jobs, healthcare, human services, education, community services such as public housing, jobs, information during the pandemic, transportation services, local and state grant, and identify any other governmental programs available to constituents. In other words, we will have an inventory of programs and what they offer. This year, we will again hold an annual summit. As example of this is 2021 Mental and Family Wellness Summit with over 200 attending and 36 vendors. And we expect 2022 to have more people in attendance and more vendors. We will continue to hold our monthly meetings virtually until we have it all clear of the COVID. And we're hoping that is very soon. Meetings allow us to share ideas, resources, and information, as well as sharing of concerns and data. Some areas of concern may go beyond the current scope of our council, such as housing needs and countywide ban, but we keep up with and support efforts in our areas around those issues. As long as COVID is a factor, we will donate food using our local and state partners and assist elderly with identifying resources such as medicine, rental, and electrical needs. We will continue to support with food resources, sanitizer, face masks, and vaccination. The community kitchen that now average around 150 daily. We will continue to give resilience kits to parents and children that include books, puzzles, balls, dolls, coloring books, and crayons, paper, art supplies, chalk, goodies, so many, etc., etc., etc. Information needed regarding South Carolina legal services is readily available by request. Clothing and other needs will be provided as necessary. Again, in 2022, we will make $25 gift cards to families in need of essential supplies such as toilet paper, sanitizers, Clorox, alcohol, and sanitizer spray. Resources are distributed in the community, and because corporations, agents, and others see the work we do, they help with our endeavors. In 2022, our virtual town hall will be based on identified needs, and the work that we do will be present not only through fatherhood initiatives, but also the Domestic Violence Summit, which we focus on every year. This year is the second year of the 124th South Carolina General Assembly legislation session, and this year is extremely critical. This year you asked me about bills that you could help with. Well, let me tell you what you can do. This year is imperative because bills filed between 2021 and 22 that do not get passed by the end of the session in May will die. For lack of better words, and legislators will have to restart the entire process by refiling the bills during this next session. So all progress would be lost. South Carolina has billions of dollars in state and federal funding, and the focus for legislators is how to allocate that money. The General Assembly must work on 3 pots of money this year outside of the state budget. This includes the American Rescue Plan Act, which is approximately $2.4 million, the Savannah River Site, which is SRA funded, SRS, which is roughly $525 million, and the Bipartisan Infrastructure Law, which is about $6 billion over 5 years. Regarding some specific bills that you asked me that what could you do to support us, H. 3620 is a hate crime bill introduced by Representative Gilliard, Representative Newton, and Representative Bernstein, with many of us signing on. It received bipartisan support last year and passed the South Carolina House, but has been held up in the South Carolina Senate Judiciary Committee. On the first day of Black History Month this year, the Democratic Caucus and Black Caucus members held a press conference to raise attention that South Carolina is one of two states in the United States without a hate crime law. We must act. Currently, a medical marijuana bill is being taken up in the General Assembly as well. At its current state, the bill would allow patients, now listen to this, to use oils, salves, patches, or vaporizers, but you cannot smoke it. Medical marijuana assists many patients that deal with and treat chronic issues and pains, and the bill would not approve recreational use. It is strictly for medical purposes. Did you hear me? Strictly for medical purposes. Now, the last topic that I would like to speak on is the critical race theory. We call it CRT. CRT is an academic concept that is more than 40 years old. There's much confusion, I promise you, much confusion surrounding what the CRT bill in the Education Committee would do. I can't tell you. We do know this, that some of these bills will try to limit what educators can and cannot teach. I urge you to pay close attention to these bills. Write them down. H 4343. H 4392. H 4324. H 4605. And H 4799. I encourage all South Carolinians to get involved. There are usually public committee meetings before bills go to the floor, where public comments or written statements are allowed. I understand this year they're only allowing 30 people. Make sure your voice is heard. Another way to get your voice heard is to call your representatives to set up a meeting. Constituents are why elected officials hold their seat and work in favor of your best interest. I want to thank you all for allowing me the opportunity to speak briefly and share information. So sorry I could not be with you today in person. Have a great day.